Well, welcome, guys. It looks like we're live on YouTube. Been streaming. We're a little late. We had some logistical concerns at the logistical issues at the county office building, so I'm over here at the division office. But thank you guys so much for coming out. You know, we did this about a month ago. Came to talk about COVID today and sort of the vaccine, and probably spend a little bit less time talking about folks getting vaccinated and maybe some other questions that we have. But real quick, for those that may be watching, Dr. Ramsey, will you start us off and everybody just give a quick brief introduction of who you are and what you do?
Sure. Yeah, I'm Keith Ramsey. I'm the medical director of infection control at Vitamin Medical Center, and what am I? Or part-time faculty at Brody School of Medicine. Yeah, I'm from the mountains. I'm a mountain guy. I'm marooned over here in the eastern part of the state for a while.
And he's being humble, but Dr. Ramsey has been our chief of infection control for a number of years and brought us some pretty incredible innovations that have helped just tons of patients.
Fantastic. Thank you for joining us today, Dr. Ramsey. Glad to have your expertise and knowledge and personality on here with us. So thank you. Dr. Garrison and the others, will you guys go ahead and introduce yourselves if you don't mind?
Sure. My name's Herb Garrison. I'm a professor of emergency medicine and the associate dean for graduate medical education at the ECU's Brody School of Medicine. I also get to serve with Dr. Silvernail on the Pitt County Board of Health, and I've been involved with emergency medical services as a paramedic and an EMS physician for a few decades.
Very nice. You don't look like it, so.
Oh, I appreciate it.
Dr. Winslow, maybe go next.
Trip, you're on mute.
Medical director, North Carolina Office of EMS since 2011. Been an attending physician at Baptist Emergency Department in Winston-Salem since 2003. Did medical school and residency at UNC Chapel Hill. Originally grew up in Roxborough, North Carolina, kind of up north of Durham, up against Virginia. Happy to be here today, and I appreciate y'all doing this.
Very good. Thank you, sir. We really do appreciate having you on. And Dr. Silvernail, I guess we'll let you have the rear.
Good morning, everybody. John Silvernail. I'm the Pitt County Public Health Director, former faculty at the Brody School of Medicine, longtime firefighter, EMS physician, EMS medical director. I am a recovering Yankee, but I stress that my home fire department protects the southern half of town. So I'm glad to be with you all this morning.
Very good. So for everyone watching, you know, we've got an all-star cast. These guys are very humble. There's a great deal of humility in the room, but all excellent subject matter experts as it relates to emergency medicine and COVID and epidemiology and public health, everything that we like to talk about, you know, mainly as first responders, but there is a great deal of other folks that will wind up viewing this presentation. And so thank you guys again. I think to get it started, Dr. Silvernail, you know, you invited and suggested that we bring Dr. Ramsey to the table just because of the significant changes over the last, you know, several weeks and months as it relates to the Delta variant of COVID, hospital admissions, you know, deaths and infection rates. And so Dr. Ramsey, if you'd like, you know, or Silvernail, if you'd like to introduce that or kind of give some background on your thoughts. But we brought Dr. Ramsey here today to discuss sort of what Vidant is actually seeing and what's happening in the hospitals. You know, we hear on the news about all of the hospitals being overrun in the last several weeks and months. So what does that really look like? And I don't know if you guys want to kick that off for us.
Yeah, I don't know that Dr. Ramsey needs any real introduction. We've worked closely for, gosh, almost the past 10 years now. And infection control issues at the hospital. And he, when I was hired at the health department, was the chairman of the board of health, and was probably instrumental in my recruiting to the health department. But I have great respect for Keith Ramsey, and think of him as my go-to infectious disease expert, and really felt like he could add to our discussion by talking about the situation on the ground in the hospital, comparing those who've been vaccinated to those who are unvaccinated, and whatever else Keith wanted to throw out to our EMS community.
Well, thank you. Thank you, Dr. Silvernail. Yeah, it's a pleasure to work with you. We work very closely with OC Health. I help out with the infectious disease part of OC Health, and it's a pleasure. And certainly when Dr. Marr decided to retire, it was certainly left us with a void, but Dr. Silvernail was interested and stepped in and has done well. So is there a way I can run a few slides? I was looking up here on the controls.
Yeah, you should have the ability to just share your screen and roll right on with it.
Okay. I don't see a way to do that. I'm sorry. Okay, here it is. I found it. I'm sorry. Here we go. Okay. Give me just a minute here. Can y'all see that okay?
Yes, sir.
Okay. Yeah, we'll just talk a little bit about surveillance. All of y'all know Bill Cleve, our public health epidemiologist, and he was kind enough to share some slides with me. So this first slide is the North Carolina COVID cases, and this is available on the North Carolina website on the dashboard. And so the number of cases, as you see over here on the right in the dark blue, basically approaches that of our peak back in the winter. So it's been a tough time for everybody, all healthcare facilities across the state. The good news is these numbers are falling. They never fall rapidly enough, but they are falling. And the data from their dashboard indicates so basically we're averaging at one point about 2,000 hospitalizations a day, and about almost 600 hospitalizations, ICU beds were filled due to COVID. And if you look at the bottom down here, it talks about the unvaccinated versus vaccinated. Of those hospitalized at that point in time last week, 82% were basically unvaccinated and 17% vaccinated. So we talked about, you hear on the national news about this being a pandemic of the unvaccinated, and that's true to an extent, but as we'll see, unfortunately, this Delta variant has overcome the impact of the vaccine in a number of folks. This is our dashboard that Brian Floyd puts out every couple of weeks. And I was looking this morning, Bill Cleve and I were trying to see if it put a more recent one out. It's very colorful here. So we've got, this was as of a couple of weeks ago. So at that time, there were 112 positive inpatients with COVID, and they colored in the vaccinated in the teal color and the unvaccinated in the orange. So as you see, again, vast majority of the inpatients were unvaccinated. If you look at the positive patients in the intensive care unit, turned out those were practically all unvaccinated, and then the ones on ventilators, they were also mostly unvaccinated except for one. So it looks like the more severe if you are vaccinated, you'll have a less severe disease, but it has not prevented certainly hospitalization in some cases. Most of these folks that are vaccinated and hospitalized have some other comorbidities going on. They've got diabetes, heart disease, lung disease, other illnesses going on that would, and those are the folks that don't do well throughout the pandemic. The bill puts these together weekly and basically shows the daily census. So this is real-time data as of yesterday. And so there were 54 patients that were hospitalized at DMC. So that's less than half what we saw 2 weeks ago. 32 of those are isolated. Some of the patients, after 10 days, we could take them off isolation, and for the most part. And so some folks are still in the hospital for one reason or another. As you see, the BCOMs are smaller hospitals throughout the 31 county region. And you see they've fallen off quite a bit also. Most of those have less than 10 individual patients with COVID. We're very fortunate we have Dr. Our laboratory, Dr. Fallon has put together a sequencing lab over in the Brody School of Medicine. So we appreciate Brody's support of that. And so these were the different variants. They've been sequencing the viruses since last spring. And if we go through and look, starting in July, it was Delta appeared early in July among patients coming here to the hospital. And there was just a little bit of the Alpha variant, which is the original variant. And then pretty soon it's been all Delta. So the last couple months, every virus they've sequenced has been Delta. These are basically the nasal swabs that PCR positive. They then take that swab to the laboratory, and they can't get sequenced in all cases, but every case they've got to sequence in is all Delta. So, and if you look at the epi curves, Bill puts these together. These are the epi curves, and so January of 2021, of course, we had our peak. That was all the Alpha strain. In July, it's all Delta, and it's starting to fall off. Israel's also fallen off, and for comparison, Bill put the United Kingdom and Russia in. They're still going up. So the good news is, again, Delta's falling, and therefore, since it's all about Delta these days, COVID's falling in parallel. So we'll look forward. We don't know. We never know what's coming next. Was it Yogi Berra said the hardest thing to predict is the future or something? But we'll be watching to see whether there's some other variant appears. Hopefully not. And of course, the boosters are available now for 2, if not all 3 of the vaccines. So with that, I'll stop and see what kind of questions panelists may have.
Dr. Ramsey, that's excellent information. I appreciate it. I actually recall sitting in the disaster conference before COVID got cranked up good, and you were giving a presentation about the very early parts of the COVID and where it came from almost 2 years ago now, I guess. And we've come a long way. So I guess in a 30-second nutshell, if you had to summarize all of the data, the inpatients and everything that you've seen at Vidant, is there one magic bullet? Obviously, we know that vaccination is effective and it works, but is there anything else that we should know that you've seen at Vidant that would be helpful, and maybe to, I guess, for people in the field and their families?
Excuse me. Yes, sir. We started having everybody wear a mask. I think that was in April of 2020, which was a great departure, because during flu seasons, we've never done that. Even when H1N1 showed up in 2000, when was that, 11 or 12, we didn't have everybody wear a mask all day in the hospital. So that was a step that was taken. Masks are effective. Now we wear, of course, surgical masks, and then we wear the N95s whenever you have a patient who's actually, has COVID and is having some sort of a procedure going on. But the mask worked very well in the healthcare setting. And so in addition, and then of course we waited for the vaccine. So good hand washing, wear a mask, social distancing. And I'll give you a quick anecdote. For example, back in the summer when the governor lifted some of the restrictions about mask wearing, I think it went about 7 or 10 days without wearing a mask, except for unless I went to a large store where practically nobody was wearing masks. But once Delta showed up, I advised everybody to go back to wearing masks again in public. And I still continue to do so, whether that's going to a movie theater, going to a large department store, and so forth. It's inconvenient. I don't like it. As soon as I get in my car, I take it off again. But they are protective. And like I say, the Delta agent, unfortunately, has overcome some of our vaccinated population. So that's another reason to wear your mask in public.
Understood. Thank you, sir.
Jim, can I ask Dr. Ramsey a quick question?
Absolutely.
So Keith, you showed the UK and Russia data, which I assume is Delta. What's going on there? Do you think? I mean, our numbers are coming down nicely, if not dramatically, and yet what's going on there, and what are the implications for us, do you think?
Well, that's a good question, Herb. I don't know what's going on in Russia, but in Great Britain, they relaxed their mask wearing and a lot of their measures back during the summer, and so it's biting them now. I saw that. I think it was in the New York Times the other day, and so yeah, they took the foot off the gas pedal, so to speak. And I'm afraid that's a mistake. So.
Dr. Ramsey, this is Trip Winslow. One question I have is I do think we're doing better right now, and I get a little nervous. People think we're through it, we're done, we don't have to worry about it anymore. People are gonna lose any motivation they have to either get vaccinated or to get a booster. I mean, what do you think the January, February timeframe might hold?
Certainly, as we all spend more time inside, there's a chance for spread of the virus. But again, I would encourage folks that are eligible to go ahead and get the boost. And it doesn't matter which one, whether you had Pfizer, the Modernas are available now. I think J&J, if it's not available, it will be soon. So I would certainly encourage folks that are eligible to get the boosters. And we'll just have to see whether another variant appears. There are some. I think I heard yesterday there were at least 20-something variants within Delta, so it's mutated. The Delta strain has actually mutated some, but we've got to just keep our foot on the gas pedal and get this thing gone. So I don't know when gone's going to be, but sooner the better.
And Keith, gone, in my mind, would be there's enough people either gotten the infection or are immunized such that the Delta can't grab hold of anybody anymore. There's not a critical mass of people out there that could get infected. Could you elaborate on that a little bit?
Yeah, if we can reduce our eligibles, we talked about the before the COVID showed up, we said, well, the most transmissible infectious agent that we deal with, at least, is measles. Of course, we don't see much measles because it's a childhood. It's one of the required vaccinations to go to school, part of MMR. And so we said with measles, you need 90% of the population to be immune in order to have what they call herd immunity, to basically contain the virus. And so basically the only people who get measles anymore are the usually small religious communities that for some reason or other haven't vaccinated their children, they'll have a little outbreak. So with COVID, we don't know exactly what our break point is on that, but I would imagine, I'd certainly appreciate Dr. Silverdale's opinion as well, and we may need to be up in that range, 80, 85%. We just don't know, but as long as we continue with, as you mentioned, naturally, those that acquired the infection likely have lifelong immunity against the alpha strain or whatever strain they were infected with, and some immunity against other strains. And then the vaccines, of course, are out there. So you add those two together, hopefully we'll get up, in 75, 80, 85%, and that'll allow us to contain the virus.
Yeah, we've talked about this, and some people say herd immunity is an outdated concept now. I think if we get, on the low end, 2/3, but we may be somewhere in that 70 to 80% or higher to have quote unquote herd immunity. We know with the original strain that for every case we counted, there were 2.5 cases that we didn't count in our surveillance that went undetected. We think with Delta, it's probably higher. I've heard some estimates as high as 6 or 7 cases for every case we could count with Delta. So I think we're probably getting closer to a point where we have some degree of herd immunity, and there are less of us that are susceptible to this infection and can support the transmission of the infection. We're still in Pitt County as of the 1st. We were 2.3 cases per 1,000, so that's 230 cases per 100,000. We're a county of less than 200,000, so I usually look at this on a cases per 1,000 basis. By the CDC definition, we're still considered high transmission because we're more than 100 cases per 100,000 in the county. But I think we're definitely moving in the right direction. Our numbers are moving in the right direction. We're clearly on the backside of Delta, and as Dr. Ramsey said, that the question is what's behind Delta, what's coming behind Delta, and how much immunity will previous infection with Delta or vaccination provide against the future variants. And I just don't think anybody really knows, but I think some protection is better than no protection. And so again, I think that's a good reason to get vaccinated if you, whether you've had the disease or not, because if you've had the disease and you get the vaccination, it raises your antibody levels and serves as a booster of your natural immunity. If you were vaccinated and then got the disease, the active infection would serve as a booster of your immunity. And so I think some protection is better than no protection, and would still encourage folks to get vaccinated.
Absolutely. Yeah. The whole purpose behind the first one of these discussions that we did was centered around being vaccinated and trying to beat the bushes, as it were, for those that are on the fence and thinking about it, especially our first responder community. And the Delta variant has proven to be, at least in my experience, it's much more pervasive. It seems it's very transmissible. Lots of people are getting sick, have been sick. My whole family and several extended family wound up with it, but because of the vaccine status, I think they were very mild illness. And so we're thankful for that. And, kind of looking at the numbers there that were up from Vidant, the Delta variant, there was some very significant infection numbers as recently as 2 or 3 weeks ago. And a level of alarm has gone down. And Dr. Winslow, I think you mentioned it, and Dr. Garrison as well, that, can somebody speak to why those numbers would go down maybe so dramatically? Are we testing less now than we were 2 weeks ago even and catching less, or is it because everyone's been infected? And, what does that mean for us as a first responder community and as a public safety at large, I guess?
Well, I do know in Great Britain, when they had the first Delta surge, it went up really quickly and then down really quickly. And I don't think people knew, at least from what I've read, there wasn't a lot of great information about why, other than the fact Delta is just so transmissible, it burned through the population really quickly and then left the population. What worries me is I honestly think in a few months we're going to have another wave. Maybe it won't be quite as bad, but I think it's just so transmissible that it goes to the population really quickly. It's just what I've read, but y'all might have better information than me.
Yeah, Jim, if I'd known you were going to ask that question, I'd have our weekly epidemic curve up in the state. If you look at this on a week-to-week basis, with Delta, you can actually see an early notch, as Dr. Winslow was talking about, where we rose very, very steeply and we started to come down. And you can see clearly there was a week where we dropped. Unfortunately, that week we dropped was the week that Pitt County schools opened and ECU opened. and our drop was a week, and then we climbed very steeply to the top of Delta and now have headed back down. But if you look at it on a week by week basis, some of those things become a little bit more evidence. And if you haven't seen your county's weekly curve, it might be worth taking a look at that week to week curve. It looks very similar to the daily curve, but sometimes you'll see those trends a little bit differently in the week to week view.
Yeah, just I'll do an editorial comment in that we sort of, I think, unfortunately portray science as being something that's very exact, and that it's so sophisticated now that we sort of imply that we know everything. If I was still doing investigations, I would prefer to just have one variable that you have to worry about, wouldn't have to do any logistic regression, could do a simple chi-square or t-test or something like that. But unfortunately, the world is a really complex place, and there are multiple variables involved, both on the exposure side, the virus, these viruses, you know, listen to what Dr. Ramsey just said. There are 27 variants of the Delta variant. So these viruses we think of as being not much DNA, but the DNA that's there is pretty adaptable and complex and can do funky things that we don't even yet understand. And then there's all these other variables of people congregating, how much are they breathing on each other, how close are they in proximity, and which one of those variables, which by the way, it's not going to be just one, is the one we have to worry about the most. And so if you go back to how did we get people to stop smoking? Well, it was a multifactorial, it was a multivariable approach. And I suspect the reason it's coming down now is all these things have been effective in some way or fashion. And then why it might go back up, and Dr. Winslow mentioned some congregating, but we don't know which one variable it is and what's the most important one. And that's why I think Dr. Ramsey's correct in that we got to throw a bunch of tools at it. We got to do masking, we got to do social distancing, we got to keep stuff outdoors, all those things to try to reduce transmissibility until we get enough of the people that have immunity so the virus just can't take hold. Did I get that right, Dr. Ramsey?
Absolutely.
So thinking about all of that, knowing we're coming into the flu season, you know, the peak of flu season anyway, in the next couple of months, and what we just went through with COVID, how does all of this relate? You know, indoor sporting events, you know, we love college basketball in our state and hockey and other things. So what should the message, you know, I know what the message has to be, you know, wear your mask inside, proper social distancing, whenever possible, you know, being vaccinated. But is there something else as a EMS community that we should be looking for to help ourselves, I guess, help us help them and help the general public?
Get vaccinated. I think we're maybe 40 to 50% is the numbers I've heard for EMS.
Still that low? Well, that's incredible.
A lot of systems are a lot lower than that, I believe.
Is that, Don, do you think that's mainly, it's all because driven by social media and politics, or is there some other reason that we may know of that people are not being vaccinated?
I mean, I think I don't think people really know, to be honest with you. I think there's a lot of preconceived notions out there. There was a lot of doubt sown in social media. Maybe there's some trust issues, but you know, the data's out there. It's a safe vaccine. There's no question about its safety. There's no question really that it protects you from getting really, really sick. I mean, no vaccine is going to be perfect, but I think Dr. Garrison, when he was talking last time, I'm going to paraphrase a lot, but it's kind of like riding down the road without a seatbelt or airbags on. Would you rather go down the road without seatbelt and airbags, or would you rather have your seatbelt and airbags ready? But this is even more protection than that. And I think I'd be curious if y'all locally at Pitt County have noticed any bad adverse reactions to vaccines or noticed any other complications locally. I mean, they everything I've read show they're extremely safe and protect you, and they protect you and they protect your patients. But I definitely think I'm more than happy to go out and visit folks and talk to them. And maybe we do need more education. Maybe we haven't done enough. I don't know. But I'm always more than happy to talk to folks and hear what they have to say, because I'm sure people do have legitimate concerns as far as they're concerned.
So go ahead, John.
I was going to say, from a safety standpoint, we're north of 13,000 doses of Moderna vaccine given at Pitt County Health Department or by Pitt County Health Department. And we have seen very few reactions. What we have seen is pretty typical. Sore arm. We have seen a few folks with COVID arm. People have a mild, sense of being ill for a day or two. Rarely does it last more than 48 hours. We have had a couple of cases of anaphylaxis. A couple of those I think were pseudo anaphylaxis, but nothing that we would expect with any other vaccine. So I really do feel like it's very safe. Johnson & Johnson, we've given a little over 500 doses of Johnson & Johnson, far less of that, but there were some rubs with J&J early. I think it's very safe. I will say from a personal standpoint, in our household, we've sampled all three. My wife and I and twin B all had COVID at the same time. He got Pfizer because he works at the hospital, and my wife and I got J&J, and then twin A got Moderna. And so we've had all three vaccines given in the household, and none of us, other than the typical post-vaccination side effects that you'd expect with any vaccine, none of us had any real problems with the vaccine from a personal standpoint. So we've sampled all three at this point.
Jim, to paraphrase your question, what can EMS do to help with this pandemic and get us to a good place? And I hold paramedics and emergency medical technicians, I put them on one of the highest pedestals that we have. I think these are salt of the earth people who are doing God's work, and so I get to see them up close and personal. But I think the general public feels the same way, is that these are really good people that are close to the action, that know what's going on, and they turn to them for information. I know their family members do. I know other members of the public turns to the medics and says, what's important, what's the deal here? Because they look at them as authority figures who are knowledgeable experts. I mean, that's how I sort of frame first responders just in general. And so as such, they are role models and they are experts. And I think one of the ways we can help with this is to be prepared when people ask us, all right, what's the deal with vaccines and what's the deal with the pandemic? And be informed, listen to talks like this, and then be prepared to go out there, because people are going to ask you, what is the deal? And I think how we help is we provide them with good information. Just to comment on how I sort of think about the vaccine is I'm very selfish and I'm very self-serving. And the first question that comes into my mind is, how do I reduce my risk? And is there a tool out there that's going to reduce my risk? And to be honest with you, I don't have time for COVID and I don't have time for long COVID. And I look at the data and say, this vaccine's not a risk thing compared to having COVID or having long COVID. And so you take the vaccine. But then the other question, I think, if you're a professional, is that how do I reduce the risk for my patients? And the way you do that is you make sure you don't have COVID. And the way you make sure you don't have COVID is you get the vaccine. I'm very simple thinking, but that's sort of how I think of things. But I think being role models is something that's part of our responsibility as EMS clinicians.
And just to tag along what Dr. Garrison said, I really strongly believe, just like Dr. Garrison said, that, at least I believe Dr. Garrison said, that EMS professionals are leaders in their community. People look up to them, and what EMS professionals do and say, it really matters. And I don't think they should ever diminish that.
Absolutely. You guys are spot on with that. It's highly encouraged around here. Everything basically just sort of a requirement to get the vaccine that's kind of where I want to segue right quick with you all. And I don't know what knowledge you may have, but I did want to ask, in EMS specifically, how do the federal vaccine mandate affect us in EMS? Is there any knowledge in this group about that issue?
Jim, I will tell you, we've looked at it with the county attorney's office. We have not seen the rule from CMS yet, but we expect that rule may require even non-clinical staff to be vaccinated if you accept Medicare or Medicaid in that office. It is a little bit murky right now, but we expect that is coming. We're following it closely, and obviously we have to comply with the law if that's the law that comes down to us. It looks like it may affect EMS as well. A fair amount of your billing goes to Medicare or Medicaid. So if there's a vaccine mandate tied to receiving those funds, that may very well have a direct impact on EMS at all levels if you're billing.
And that's my understanding as well, Dr. Silvernell, is that we fall under providers. Ambulance agencies are not specifically addressed in the articles that I've seen, but we do receive money directly from CMS and the feds, and so we are federal contractors, as it were. And for the panel here, that those type things, the word mandate and the impacts we're seeing to public safety across the country, as a EMS coordinator, it gives me great concern. It makes me really nervous of what that impact is. Seeing, Vidant and the hospital systems across the state and the country seem to have stabilized for the most part as employers, I guess, with the vaccine requirements. But it does give me a lot of heartburn thinking of what a vaccine mandate means for our employees. Especially knowing the effectiveness and on a voluntary basis that you should do it anyway. Is there any discussion, Dr. Winslow, maybe across the state? Do you hear anything, from others that we could share, for decision makers that might be important?
Yeah, I don't have any insight about this. I know there's the CMS rules that are going to be coming out, but as Dr. Silvernell says, I don't think they have the rules out yet, and really the rules are what matters. And the other thing I was going to, and this is not a rhetorical question, I do not know the answer to this. This is for Dr. Silvernell. What about the OSHA rule? Isn't there going to be an OSHA rule also requiring for organizations over 100 people, something about?
Yeah, Trip. Thanks for that lead in. That's the other thing that's lurking out there from a mandated standpoint. The president has directed OSHA to create a rule requiring employers with 100 employees or more to mandate vaccine as part of general workplace health and safety. OSHA, to my knowledge, has not yet written that rule, but we expect that's coming as well, and that may have impacts on us. Pitt County, for example, our workforce is about 1,000, so we'll be covered. The Vidant workforce is 15,000. Of course, they've already got a mandate, but it will affect a lot of folks. And again, we need to see that language before we can help enforce it or comply with it. I will say one of the things that we've done here in Pitt County with Jim and Dr. Portella's help is to do roving clinics for our first responders. Jim and Dr. Portella were gracious enough to take vaccine from the health department and go out to several of our EMS agencies, fire stations, and give COVID vaccinations. And once we get those folks retrained on the booster issue, because there's some subtle differences there, boosters and third doses, we're going to send them out to give some boosters and third doses as well. So I'm looking forward to doing that to help make it convenient for our responders to get the vaccine. And we'll gladly give first or second doses while we're there too.
And Dr. Silvernell, I think that's a great example. Before we were talking about how EMS professionals and should be leaders in their community. I also think as medical directors and EMS administrators and hospital administrators, can't take a hands-off approach and say, well, this is just, you go with this however you want to go with it. Granted, people have to make their own decisions, but it's also our responsibility to educate ourselves and educate the people in our agencies. And going out and giving vaccine, I think is a good way to demonstrate that you believe in the vaccine and this is important. And as an EMS chief or whatever, it's important for those chiefs and other administrators to educate themselves about this and be leaders and be seen as leaders on this for their agencies, because widespread vaccination is the only way I really think we're going to get out of this.
Yeah, just another editorial comment, because I don't have expertise on these rules and mandates coming down from the feds. But the way I think of it is, again, pretty simple. And probably we should get rid of the word mandate because it's now acquired so much baggage. But any place that I've ever worked, and now they do these things online, but there are huge policy books. And some of the policies are really simple. You show up on time. You park in between the lines, you wear your name tag. I mean, this is just a function of how it is in the workplace. And so another policy is we need you to be vaccinated against COVID. And if you've got a medical reason or a religious reason, there are provisions to express that. But in general, it's just another policy of how we get work done here, keep our people safe and keep it safe for our patients. And I think that's the way we have to think about this. I think we've just loaded way too much baggage onto it's a mandate. I don't know how we got to there, but I think we could think about things way more simpler, maybe. I'll tell you that I'm going to get in trouble for saying this, I'm sure, but I'm going to blame it on my dad. So when I was growing up, I said to my dad, am I required to mow the grass? And he said, no, you're not required to mow the grass. You're also not required to sleep in a house that has a roof over it. And you're not required to eat the food that we put in front of you. Your call. And that's sort of my philosophy on this thing.
So Dr. Garrison, I think you're spot on. Personal responsibility is something that we don't preach. We're all accountable for our action or inaction in some cases. And, we need to be aware that our decisions have downstream effects. We are entitled to free speech and opinion, I guess, but we're not entitled to be free from consequence of that opinion or free speech. And so we have to be mindful of that, especially as community servants. Most of us in EMS and we either work in government or contracted by government in other regulatory agencies. And so we have to be aware that that what we do is magnified for the public. And so our decisions have larger consequences in many cases.
That was very well said, Jim.
Well, thanks. Sometimes I get it right. But so, I guess I just wanted to put that out there that we, the word mandate, I don't like that word as well. But it's a buzzword right now. And we know that the feds are making requirements that are going to have impacts. And, Dr. Winslow, the same thing across the state. Every EMS system is drastically different, in how they're operated. But for the most part, we're a fee-for-service type business, and we get a lot of those fees for our services from the federal government. And so we have to be aware that whether we're government, third service EMS agencies, or rescue squads, nonprofits, whatever those are, that we have to be prepared for the impacts that come down to us. Really, whether we like it or not, it doesn't matter at this point. And I did want to change gears on you guys one more time, that the vaccine is now available for kids, 5 to 11, I think, or 6 to 11, all the way up through the teenage years. And a lot of us have children that, people that are all into the vaccine. there's probably more on the fence because there's more misinformation and misunderstanding and ignorance about the vaccine for kids. Can somebody, can you guys kind of give us a little information on what's the current status, I guess, the current status of the availability of vaccine for kids, and should we be doing that?
Jim, I guess that's probably going to fall to me, and then I don't know if Dr. Ramsey wants to jump in or not. Pfizer has had an approval for 12 and up on their vaccine. Originally, it was approved for 16 and up. They added an indication for 12 years to 15 years. And a number of children have had that vaccine in that age group. I literally, about 15 minutes before this program started, got the notification from the state that the Pfizer vaccine was approved. Of course, it was in the news, and this is one of the things these days that drives me nuts is that this seemed to be a fait accompli, and everybody knew it was going to be approved, but we don't get the stuff until 12 hours after it's approved. So I have a 43-page document on my desk regarding the vaccination for 5 to 11-year-olds, which is the approval for the Pfizer drug now. This will be a different formulation. It'll be marked differently, packaged differently for children. It's the same vaccine, but it's a smaller quantity of vaccine or smaller quantity of antigen in each dose of the vaccine. We received a small supply of that today, about 300 doses today that are in storage, waiting for us to train our staff on this new policy so we can give it. It is available. While one of the things, and this kind of builds off of something Dr. Garrison said earlier, is that we don't know what we don't know about this thing, and we look at age is probably the single biggest risk factor for bad outcome. Then there are several underlying conditions that make people more likely to have a bad outcome with COVID. But there are host factors that make the behavior of this virus in an individual unpredictable. So there are high-risk folks who have very minimal disease, and there are some very low-risk individuals who have very severe disease with COVID. So children in general are at low risk, but again, some protection is better than no protection. The vaccine we have given nationally hundreds of millions of doses of this with nothing more than typical side effects. So I think that the safety of the vaccine is well established. Yes, there's less experience in children, but this is available. And again, the management of the vaccinated individual after exposure is different because we can observe them, leave them in their normal activities. And for children, that means leaving them in school, being able to keep them in school if they're exposed. And we know that education has been so badly disrupted by this COVID pandemic.
Well, John, maybe you can give us a Cliff Notes version of your document on your desk there. Herb and I'd probably enjoy reading that.
I'll see you get a copy of it.
Yeah.
Only the Cliff Notes. Only the Cliff Notes.
I haven't seen a publication yet, although I'm sure the New England Journal, maybe I missed it or it'll be out soon, about the vaccine in the younger, the 5 to 11-year-olds. But certainly it's proven safe in the teenage group. The only concern there is there's been some myocarditis. I think it's mostly been in teenage boys. And I think Moderna there may be some, I'm not sure if it's a warning or just I heard there was some warning coming out about Moderna and the myocarditis, but I'll tell you a quick anecdote. I've got a teenage daughter, and last spring when the teenagers, basically, as Dr. Simnell mentioned, were approved, I asked her about setting her up an appointment to get the vaccine, and she said no, she didn't want to be sterile. I was like, what? So I said, I told her, don't be listening to that stuff on Facebook. But all these little teenage girls at school had, heard that it would make them sterile. So at any rate, we got over that one, and she finally got the vaccine back in the summer and did fine. But just goes to show you're never a prophet in your own house. And then the other, I guess the other question comes up about the blood clots, clotting disorders with the J&J vaccine. And the question is, if you had a spouse or a child or something that was on estrogens, would you use J&J or would you go for the mRNA vaccine? So those are some of the things I think it's important to talk about with your patients, individual patients, when they have concerns.
If I may add something, I know the American Academy of Pediatrics came out and actually said they were very glad of the decision of the FDA and CDC of the vaccination, and they are all in favor of vaccination for kids. So the same way as the Obstetrician and Gynecology Association came out last year in favor of vaccination in pregnancy. During pregnancy, the same thing happened with the American Academy of Pediatrics now.
I tell people the disease is much worse than these side effects, be it blood clotting or temporary myocarditis or pericarditis. Disease is, tenfold higher or more with complications.
Very good.
Jim, can I jump in for just 1 second before we move on? Dr. Ramsey's right to bring up the myocarditis issue. It does seem to be more in teenage boys, teenage males with that. But I would point out that there are also a number of viruses around that can cause myocarditis in teenage males. So, and I don't know that the risk of the myocarditis from the vaccine is any greater than the risk from one of these viruses that often circulate in the spring. So we see these sometimes with what are called the enteroviruses, but several families of virus that can produce myocarditis in young males. So that's probably not necessarily a reason to not get the vaccine. These cases have been mild, as far as we know, and with no long-lasting side effects or problems from that, self-limited myocarditis.
Just to tag on to that, the myocarditis associated with vaccines, it has been self-limited and people have recovered, but they've also shown, as Dr. Ramsey was saying, that the disease is much worse than any small adverse events from the vaccine, and everybody's going to get COVID sooner or later, especially if they're not vaccinated. And if you get COVID, your chances of getting myocarditis are very high. I think there was one German said they did MRIs of the heart on about 100 patients after COVID, and about 60% of the patients who got COVID had myocarditis. So that's just something to keep in mind.
Yeah, so I think that we all, we're all in agreement on where we stand with it. I actually had a viewer question, that they were asking, why can't anyone talk about people that have immunity from natural antibodies? And we actually did sort of discuss that earlier today, that there is some protection available from getting a COVID and having a mild infection. And then, you have the natural immunity, but can Dr. Silvernail or Dr. Rand, can one of you provide, just the 30-second overview that just because you've had the illness and you have the natural immunity built up, that the vaccine just supplements that? Or if you've been vaccinated and then get the illness again, it's simply a supplement to help you do better and lead to a better outcome. Is that fair or incorrect, or would you add anything there?
Well, that's correct. We certainly don't advocate folks going out and catching the virus, as Dr. Winslow mentioned on the call here. The side effects are such with this. The amount of inflammation induced by this virus is unlike anything we've ever seen. We knew that flu would induce inflammation. There's papers talk about heart attacks and strokes within the first 3 months after flu, but this one is on a whole different scale. So we certainly want to make sure that certainly the vaccine is the better way to go. we did exempt our healthcare workers who had prior infection from the vaccine. And MUSC did the same thing. I think University of Pennsylvania, that's one of the ones I know about. I'm sure other hospitals have done similarly. But we've had a number of, particularly providers, who had the disease and recovered and then, went ahead and got the vaccine anyway, voluntarily. As Dr. Silvernail mentioned, it does boost the amount of neutralizing antibody, which will inactivate the virus. So it's we'll see what happens down the road. I've been sort of frustrated with the vaccine manufacturers that they didn't go ahead and bring out a Delta variant as part of their vaccine. I understood they were doing trials, but I haven't read anything about it. I was kind of frustrated that they didn't push that out, because any of y'all that heard me speak at the beach meeting a couple of weeks ago, Moderna basically had the vaccine constructed in 4 days in February of 2020. Now, of course, they had to undergo all these testings and animal studies and everything, but they basically constructed the vaccine in 4 days. So that's my soapbox.
I think there was a recent study also that came out recently looking at vaccinated folks versus people who got the natural infection, and the folks who were vaccinated the folks who weren't vaccinated but had the natural infection were twice as likely to get a reinfection as those who had been vaccinated to start with. And there was another study that came out recently looking at folks who got the natural infection, and looking 3 or 4 months out, they had a much higher death rate from other illnesses compared to other folks, whether it's from the inflammation, probably strokes or whatever. But the folks who were vaccinated had a much lower rate of getting those follow-on deaths from other causes than the folks who got the infection without being vaccinated. So that's one thing I don't think we've really been able to capture, is just how many people die from other causes, probably from the inflammation they got from the natural infection. But y'all probably know more about that than I do.
Hey, Jim.
Yes, sir.
I just wanted to say thank you for allowing me to serve on this panel, and I apologize, but I've got to go for a noon appointment. Thank you.
No, thank you, sir.
Thank you, Herb.
See you, Herb.
Have a great day, Herb.
But that's why it's 12 o'clock, folks, and I know that we're all up against it. I've asked you several questions that I had, and we've had some good discussion. This is really valuable, and we're going to be pushing it out. And as we go along, if you think we need to continue doing this, Dr. Winslow, across the state, I've really loved doing this, and I love just people that are smarter than me. I like to get in the same room together and chat. And I know with COVID, we all have to be distanced from each other properly and whatnot. But this is really fun and exciting. And I really appreciate all of your time. We've been on about an hour. Sorry, I was a little late this morning. But, Dr. Ramsey, I appreciate your guest appearance and your information. Continue to do the valuable work that you guys do at the hospital, and Dr. Winslow, Dr. Silvernail, Dr. Portello. Thank you guys tremendously. I really appreciate it.
Well, thank you. I appreciate the opportunity to be on.